It is still your number one family radio, Inspiration 92.3 FM. Welcome to the show. It is Drasa Health Trust, and they are back again with another interesting episode of the show. Now, today's special edition which kicked off on World Patient Safety Day, is dedicated to the topic of patient safety. Now, Drasa Radio Half Hour will be featured on Inspiration FM. Inspiration 92.3 FM every Wednesday from 11:30 to 12 p.m. So make sure you are always a part of that. Now, if you're tuning in for the first time, DRHHA stands for Dr. Ameyo Stella Adadevoh, the courageous doctor who identified the first Ebola patient in Nigeria in 2014, but she later died after contracting the infection from the patient. Now, her actions and sacrifice, which will never be forgotten, saved the lives of millions of Nigerians. Now, DRHHA Health Trust is a non-profit public health organization which was established in 2015 to continue her legacy of protecting the health of Nigerians. Now, in the studio with us today, we've got two members of the DRHHA team, and they are here with prizes. So stay tuned for a chance to win those prizes. Now, our first guest is Nurse Christine Akowa, who is a project associate at DRHHA Health Trust. She's a certified nurse midwife with experience in clinical nursing, school health, and management of illness and disease, with a focus on ensuring wellness in both rural and urban communities. Ladies and gentlemen, please welcome Nurse Christine Akowa.
Thank you.
Next up, we have got Moyosore Odumesi, who is a project associate at DRHHA Health Trust also, and she has experience in managing health projects and mobilizing communities to take action to better improve their health. Ladies and gentlemen, let's welcome Moyosore Odumesi.
Thank you.
Welcome to the show, guys. All right, so let's get into the conversation for today. Last week, we learned what the World Patient Safety Day event is all about. But what can you tell us about tips that we can use to make sure that patients, which include, us and our loved ones, what we can do to ensure safety in a healthcare facility? Nurse Christine.
Okay, thank you, Kiki. It's always a pleasure to be on the show. For those of us who joined last week, I know we had a discussion where we had to talk about patient safety, why it's important, and why we celebrate it. So just a quick recap, it's marked every year on 17th September to raise public awareness, bringing patients, families, healthcare workers, policymakers and communities together just to highlight the ongoing hardworking efforts put together to ensure the safety of everyone. Today, we have something very interesting to talk about, and we'll be focusing on what are the tips we can actually do to ensure that every one of us, when we're in a healthcare facility, is safe. And this morning, we'll just be focusing on two unique groups of people, that is our children and the elderly loved ones. The reason why we want to focus on this two group of people is basically because oftentimes they're always dependent on others for support and then majorly struggle to protect themselves while in a healthcare facility. What I mean is that there are so many things that goes on in a health facility, right? Yep. A lot of things, right? So people go in for care and all of that, but how can we guarantee that our children, when they go with us to visit maybe a sick loved one in the hospital, how can we guarantee their safety? The first tip we'll be talking about is medicines.
Okay.
So for our children, we want to ensure that we keep them away from medications. Remember, when they go to visit our loved sick ones, of course, they go there, see everything on the bedside. They want to touch everything, right? So that's the reason why we tell parents, most especially, that please don't always tell your children that medicine is candy just so you want them to take it. It's a great risk, because imagine them going with you and then they just see medicine on the table and they're like, oh, that's candy, and then they pop and take. So that's why we want to ensure that when our children are going with us, ensure they are kept away from drugs in a healthcare facility. That's for the children. Then for the elderly loved ones, interestingly, though, even if they would not really explore, take medication like children would do, but their old age is a challenge. Poor eyesight, weak muscles, so it's always a struggle for them when they want to take medications by themselves, right? So during in terms of ensuring that our elderly loved ones are safe, what we would majorly do for them is that always assist and support them in making sure they are taking their medications. Why? That's the only way for them to be able to take their medications safely. So don't leave them alone when they have to take medications by themselves.
Supervise.
Yeah, exactly. So the second thing is on hand hygiene. For our children, of course, they climb upstairs, they're touching the wall, touching the drip stand, touching the bedside table, and all of that. It's touch. It's normal. They just want to naturally explore. They just want to naturally explore, right? So for them, we want to ensure that they always wash their hands often with soap and clean running water as they are leaving the health facility. Why? A lot of things go in and out of the hospitals, right? We're not saying our hospitals are not clean. We're just saying that with a whole large chunk of activities going on there, germs will still spread. Definitely. And the hand is the most common way that every one of us can easily pick up germs. So that's the reason why we always emphasize hand washing. Always wash your hands. So that's the way we can keep our children safe. Then for our elderly loved ones, we know now they are old, they can't really always move around with themselves by themselves, right? So we always ensure that we assist them, maybe lift them up when we know that, of course, they will touch, but just try to assist and support, lift them up to make sure that they wash their hands with soap and running water. Then, finally, still on our children, we want to actually talk about keeping them safe by making sure they use bedside railings. Maybe if they're hospitalized, right? They're prone to fall, of course. Oh, mommy, give me this, mommy, that, daddy, and all of them boom on the floor. So we always want to ensure that our children are safe, protecting them by using bedside railings to prevent fall, and make sure they don't go to wet environments, wet floors, so they don't slip and maybe have an ankle sprain or something. Then the same applies to the elderly loved ones. Ensure they also use bedside railings to ensure that they don't fall, because of course they are weak, they are old. When they fall, we all know the complications that come out of that. So those are just the simple tips we can actually employ to make sure that our children and our elderly loved ones are safe within a healthcare facility.
But that I mean, that's for us as the loved ones, but I feel like the hospitals too should have like some certain level of responsibility in things. Of course, like they do. Especially the bed railings one, because I've heard stories of people just falling off the beds. And it becomes worse than it's.
You can make requests. Just ask for it. That my mom, my dad is old. Can you? Sometimes if there's no bedside railings, they can use support side pillows. Just keep by their side and. All right, so please, it's very important that you pay attention to your children. Don't let them run around and be touching everything. Of course, it can be very disastrous. In case you're just joining us, we're live with our guest from Dr. Ameyo Stella Adadevoh, aka Drasa Health Trust, who have been discussing safety tips we can use to make sure that we are safe in a healthcare facility. Since all of us, whether we've been a patient before or you're a patient now or you will be a patient in future, all of us can be a patient one day, or and they're ready to take your questions. So if you have any questions, you can send us a WhatsApp message on 0817 313 6193. That is 0817 313-6193. Don't worry, ask any questions. Our guests are here to answer any questions that you may have, and also they are here with prizes, so stay tuned for a chance to win a prize during the quiz section that is coming up just in a bit. All right, Moyo, sorry.
Yes, thank you. Thank you, Christian, for sharing how our children and elderly people can be safe in the hospital, because yes, we can all agree that they are very important groups of people. So now let's look at other areas that we can make sure that we are safe when and if we are patients, because in this life nobody's above sickness. May God help us at the end of the day. So we all know that when we are sick, getting medicines or taking medicines is a big part of treatment, whether that medicine is a tablet, whether it is drips, whether it is injection. We shall have to take it to feel better. But let me ask us, the last time that we got a prescription from a doctor, that prescription is that that paper that doctors will write with their fine handwriting, say go to the pharmacy, take it to the pharmacy. I judge
you with that fine handwriting that you said.
So yes, so the last time you got that kind of prescription, did you ever wonder why they wrote this medicine for you? Did you ever understand, or did you ask or understand what that medicine was for? Yes? No, I don't know. Don't worry too much about your answer, because we are looking at medication safety today, and I'm sure that we'll be able to learn it, at the end of the day. So now, for those of us that tuned in last week, we mentioned how one of the ways that patients can be harmed is through when mistakes are made during drug prescription or when administering drugs to patients. So medication safety is all about making sure that harm does not happen to the patient when you are prescribing those drugs to them, or when you are giving them the medicine, whether it is injection, whether it is tablets, whether it is IV drips, basically. So now, what can we do on our own part, as the patients, to make sure that we are safe when we are taking these medicines? So one of the things we can do is to ask questions. I know most of us will say, oh, the doctors, maybe they might not answer you, or the pharmacist will not answer you, or I'm very shy. But rather than being shy, we should, ask questions politely. Hey, doctor, you've given me this yellow tablet, this red one. What is it for? You have come with the doctor, then the doctor, you have headache, your body is paining you, you are stooling, something. So you are here to say, they'll give you like 10 tablets. Ask what those tablets are for. Oh, they're about to inject you. Please, this injection, what is it for?
Anti-eye.
Yes.
People have asked that question. No, I mean, honestly speaking, people have asked that question. But then we've had the doctors that will say, are you the one that will tell my job?
Yes, I understand.
Or nurses, my God. Sorry, I know that nurse Christy, you're a nurse.
Your
colleagues.
I think I can share that. I understand that your sentiments. Yes, and I think I know the doctors might not be listening to us right now, the healthcare workers, because they're probably busy. Yeah. But I think we also implore them, which we also beg them to do or plead with them to do, to listen to patients. When they ask questions, respond to them in a polite and gentle manner. So, but please still ask. Don't say because they will still ask, because at the end of the day you are on the receiving end. So ask questions. And while we're asking these questions, we should share any side effect that we might have experienced in the past. So if the doctor is writing chloroquine for you, I know that the last time you took chloroquine, your body was itching you, your face was swollen from the itching and everything. Doctor, please, this chloroquine used to make my body itch. Doctor, please, these drugs used to make my body. Don't assume that, they know what they are doing. Maybe they are doctors. Now they did not know that you have any side effect. They did not know that you experienced that the last time. So when they're asking you, do you have ulcer? Don't say in your mind that God forbid, I don't have ulcer. You will not tell them, because ulcer patients are not supposed to take some drugs. So that's on drug prescription. Another thing we should try to do is I know when they give us drugs, they have some small pamphlets inside them, those small like a paper that contains so many information. I know there's always so many information there, but we should try to read this paper, or even if it's the carton of the drug, just read it and see what it's all about, because they have some really important information there. And let me quickly narrate something that happened to me. So a few months back, I had cough, just cough, and I went to a local pharmacy to tell the pharmacist there to recommend the cough syrup for me. So I went home, took this cough syrup, and next morning I woke up and my hands were basically shaking, like tremor, and my heart was beating bim, like as if it wants to come out from my chest. And I was wondering, what's happening? But it just occurred to me, okay, check this pamphlet, check this paper that was inside the cough syrup, and I realized that one of these things I was experiencing, some of the side effects of those drugs. Immediately, just wore my clothes and went straight to the pharmacy, and the pharmacist was like, oh wow, not a lot of people experience this side effect. Like I was one of those few, very, very few people that come down with this side effect. So imagine if I did not think to do that, and I was just thinking that maybe my village people are working overtime on my matter and they're out to get me. So those things are actually very important. Then I write that pregnant women shouldn't take this drug, and maybe the doctor or the pharmacist did know that you are pregnant. So those things are very important. We should also try to store our medicines and the containers in store them well, so that water doesn't erase what is written on it, so that you don't know when they give you so many drugs, you don't know if this one is saying Livaquin or something, the pain or this thing, and you just take this one too, those things might be harmful to us. So we need to store our drugs safely, just like the way we keep our money, basically. And I think another thing we can do, I know this might not be very feasible or realistic, is to have the phone number of the hospital. Or the facility that you receive care, just in case maybe the tablet that was meant for you, your child mistakenly took like 6 at the same time, and you want to quickly call somebody that something just happened. Will you have any effect on that child? You want to ask important questions. God forbid in the middle of the night you start experiencing some things. You want to. I know this might not be feasible, or we might not be able to do it for all health facilities. For places where you can, it's okay to have their number. Another thing we can do when we are taking those drugs is use it the way they've told you to use it. If your doctor has said, or the pharmacist has said, use 2 in the morning, 2 in the night, 2 in the, don't say day 1, they say I should use it for 3 days, but day 1, day 2, no, I'm already I'm not using it again, because completing that dose will actually make you feel better. That's why we have people treating malaria 1 million times, I'm exaggerating, in 6 months, because we don't, sometimes most people don't finish their doses, and they just think that I'm well, I'm ready for it. But these germs that are causing diseases As you're not finishing your drug, they're taking a day she. So don't worry now. And they're gaining more power. So by the time you will now use that drug again,
it won't work.
It won't work. They're already resistant to those drugs. So another thing we should do is to not use someone else's drug. Let's say should be some people, they used to see that it's malaria that is doing them. I'm feeling like I have malaria. Don't say because my sister used these drugs when she had malaria, so me too I can't use it. If a drug is not prescribed to you by a doctor or a pharmacist, please do not use it. Don't self-medicate. Don't think, I think it's ulcer that is doing me. My stomach is biting like the way ulcer people say it used to do them. So I think it's ulcer. Sometimes you do not have ulcer and this is something else. So don't self-medicate. I know that it's very easy for us Nigerians to say, it's malaria. I'm very sure. And you just go there, to get anti-malaria and just use it. So please don't self-medicate because you might be taking medicine for wrong sickness, especially when those medicines are not even prescribed to us by a doctor or a health worker. So yes, we know that we should ask questions and we should, check the pamphlets, those papers in our drugs to make sure that we stay safe when we're taking medicine. So finally, I would like to discuss briefly or talk about something we call infection prevention and control, IPC practices for short. So these IPC practices, they are measures put in the hospital to make sure that the health workers and the patients are safe within the hospital environment. So how does this concern us as patients? Is to ensure that whoever is, for example, drawing blood from you, taking your blood, wears gloves. So somebody's coming to, they want to run some tests. The doctor has asked you to do some tests. They want to collect blood from you. Please, don't let them tell you that I've been doing this for 15 years. I know what I'm doing. Make sure that they wear their gloves because you don't know where their hands have been to. And you don't want to get infected. You don't want to be going to the hospital complaining of headache and you're coming back with, I'm exaggerating, but maybe TB, for example, because there are some infections that we can carry when we go to the hospital. Another thing we shouldn't do, please don't contribute to keeping the hospital environment dirty. You're in the hospital. I know that we are so used to dropping food. We just finish eating we're in the waiting area and we just drop our food packs on the floor like that because we're contributing to the those rodents, the rats, those germs that they are very harmful. So we should make sure that we join forces to keep the hospital environment clean. So don't litter everywhere. Respect the hospital basically. Don't go you see hospital in front of your hospital, you will not go and wee there in front of the hospital. Please don't let us do those kind of things. And lastly, last but not the least, is hand hygiene. Hand hygiene, it sounds very simple, but it cannot be overemphasized. We cannot talk about it too much. It's very simple, but it's very important. So when you're leaving the hospital or the health facility, please wash your hands. You are leaving because you don't know, as you are sitting there and waiting for the doctor to see you, touching the doctor's table, you don't know the germs that you've picked up. So it's very important that we practice hand hygiene regularly when we're in the hospital. So I think that will be all for now. Today. Yes, for now till next week. I hope that we've been able to learn it, too. So over to you, Kiki.
Because we still have gifts I want to give.
Yes.
But we'll take a short break and we'll be back. All right, stick with us. When we come back, we open the phone lines to give out gifts. If you can answer our questions correctly, that is. Stick with us. Don't go anywhere.
Do you know many patients face risks while receiving care in the hospital? Tune in to Drasa Radio Half Hour Show every Wednesday from 11:30 a.m. to 12 noon. On Inspiration 92.3 FM Lagos and learn about patient safety as we explore simple tips to create safer hospitals and healthier communities. Don't miss it. Safety starts with you.
All right, it is still your number one family radio, Inspiration 92.3 FM. Of course, the phone lines are now open for our listeners to call in to answer questions about what has been discussed so far. So basically, you have to have been listening to be able to win a gift from Drasa. All right, they'll be giving prizes to the top 5 callers who answer correctly. So we hope you've been listening well. Only 5 prizes to give away, so get ready to dial in. Number to call is 0700 923 923 923. That is 0700 923 923 923. Or you can also call us on 0916 067 2362. Let me see. Do I have a caller? Hello.
Hello. Good morning.
Hi. Good morning. Welcome to the show. What's your name and where you calling from?
My name is Kofurona. Calling from the Highlands.
Kofo, all right, Kofo, are you ready for your question?
Yes, please.
Pick.
Okay, Kofo, mention 2 practical tips that ensure the safety
Pick up, please. I can't hear you clearly.
Can you hear me?
Yes, please.
Okay, I said mention 2 practical tips that ensure the safety of children in a healthcare facility.
One of these is when they sleep on the hospital bed, they should make sure that they use the bed railings.
Great.
And then the habits of children, parents telling the children that drugs are candy should be stopped.
Excellent.
Kofo, they bust my head.
Well done, Kofo.
Well done, Kofo. All right, Kofo, send your name and your number to our WhatsApp platform. All right, 0817-313-6193. Kofo, please do it now, before they leave the studio, so they can get your numbers and process that. All right, 0700-923-923-923 is the number to call. 0700-923-923-923. That's the number to call, or you can also call us on 0916-067-2362. 0916-067-2362. We have one question, we have one caller down, we have 4 more to go. So you can win yourself a gift from Drasan. All you have to do is you have to have been listening. It's very, very, very easy. We have a message here from Patrick from Ikotun. He says, good morning, Drasan. One thing is to wear gloves, another is the hygiene standard of the gloves. I think it's better to wear the gloves in the presence of the patient, straight from the gloves pack. And that's Patrick from Ikotun. Okay, we have a message here. This one says, hi Oikilomo, you guys say when she had cough she went to a pharmacist for cough syrup. Who is responsible for prescribing or diagnosing what meds to take for patients? Is it the pharmacist or is it the doctor? And that's Jobang from Birmingham who wants to answer that question.
Okay, I think I can take Jobang from Birmingham. So
yes,
the doctors are responsible for prescribing. But I think when we come to a setting like Nigeria, most Nigerians, their first line of treatment or point of contact is the community, the local, pharmacies and chemists that we have. So the first thing, they don't want to go to the hospital. They don't want to go to the hospital for things like cough. So they would first go to the pharmacist, so to just get anything they can do to get well. So prescribing is the doctor's responsibility.
But we also have pharmacists who are they are pharmacists.
Of course, I'm not disputing the fact that they are, very learned, but the prescription must come from the doctor.
All right, let's go. Hello, good morning.
Good morning, Mom.
Good morning. What's your name and where are you calling from?
My name is Diamond and I'm calling from Lagos.
Sorry, I didn't get your name.
Diamond Royal.
All right, calling from Lagos. All right, Diamond Royal, are you ready for your question?
Yes, Mom.
All right, go ahead.
Okay, Diamond, list 2 IPC measures measured on the show today that a patient can be safe in a healthcare facility. Just basically tell us 2 IPC tips that was discussed on the show for you and your loved ones to be safe.
Okay, Ma. Number 1, wearing the hospital workers wearing gloves during blood collection or blood transfusion.
Yes. One more.
Number 2, hand hygiene.
Excellent.
Congratulations, Diamond. You know what to do. Send us your name and your number. Send us your name, your number to our WhatsApp right now. Now, before they leave the studio. All right, thank you so much. The number to call is 0700 923 923 923, 0700 923 923 923, or you can also call us on 0916 067 2362. That is 0916 067 2362. Diamond Royal, please send your details now to our WhatsApp 0817-313-6193. Let's see, could this be our third winner for the day? Village people. Oh, my taste. Hello.
Yes, it's me, Royal.
Oh yes. What happened?
I did not know what you said I should do.
Yeah, I said send your name and your number to our WhatsApp right now. 0817 313 6193.
0817
313
313
6193.
6196.
Yes,
Okay.
send in now. Hello, good morning.
Hello?
Hello, good morning. Welcome to the show.
Good morning, Kiki.
Yes.
Uh,
What's your name and where you calling from?
this is Pius calling from VI.
Pius from VI. All right, Pius, are you ready for your question?
Yes.
All right, go ahead.
All right, Pius, can you tell us 2 practical tips that ensure the safety of our elderly loved ones in a healthcare facility?
Yes. One of them is use of bedside railings
Okay.
to prevent them from falling,
Okay.
and also assist them to ensure when they want to assist them in ensuring that they use the drugs being prescribed to them.
We have a winner.
Pius, my guy! Pius! Oh my God, Pius! You know what to do now. Send your name and your number to our WhatsApp platform right now. We have less than 30 seconds. So last words.
Yes. Thank you to all our listeners. We are glad that you tuned in today, and I'm sure that you must have been able to pick something. This edition is dedicated to raising public awareness about patient safety, because we are all, we all have a role to play. Once again, we are Dr. Ameria Stella Adadevoh Health Trust, called DRHH1 for short. We're a public health non-profit organization committed to developing health champions like you. We want you to be a part of our 56,000 plus health champions in our network, who are always taking charge of their health and helping their loved ones and people in the communities to do the same. You can follow us across our social media channels: Twitter, Instagram, and Facebook. We are at DRHH Health Trust. DRHH is DRASA TRUST. DRHH Trust across Twitter, Instagram, and Facebook. Yes.
All right. Thank you so much, Nurse Christine and Moyo. DRHH will be back next week, same day, same time. Next week, Wednesday, from 11:30 to 12, to share more useful information on how we can stay safe and healthy in this time. So join us again then at the top of the hour, which is right now. It'll be time for the World News. 12:15. Body Bruno will be here with Sports Waka, and at 12:30 we'll make a return on the midday rewind. Stick with us. Do not go anywhere.